everyone, my name's Kate. I work for the Switched On team. We are the Substance Misuse Education and Information team for Cardiff and the Vale. I'm going to talk to you today a little bit about cannabis. So there are lots of street names and brand names etc. for cannabis, so we don't really need to go into those. There's literally hundreds of them. The scientific names are cannabis sativa, cannabis indica, but the generic names are kind of weed, cannabis, marijuana. Okay, the type of drug it is it's a depressant and a hallucinogen, so it has kind of different effects on people. So the desired effects are usually relaxation, euphoria and hilarity. The side effects can be anxiety, paranoia, low blood pressure, short-term memory loss and the munchies. So some of the short-term risks can be confusion, laziness and lack of motivation. Long-term risks, it can be really habit-forming, okay, so it can be difficult to stop using, damage to the lung tissue, risk of damaging mental health conditions, and just basically having an effect on your everyday life. So reducing harm, we would always say, don't tick, only buy what you can afford. Exploitation is a real risk. Rather than smoking, eating is a safer method, although not completely safe. They don't carry the same risk to your lungs, however, the results can be much slower and much longer lasting. And again, if somebody's in trouble or somebody needs help, don't be afraid to ask for help or call 999 for an ambulance in emergency. There are always more information on Dan 247.